Broadcasting live from the Business Radio X studios in Phoenix, Arizona, it's time for Phoenix Business Radio, spotlighting the city's best businesses and the people who lead them.
Hello and welcome to Phoenix Business Radio, broadcasting live from the Max 6 Entrepreneurial Center right here in Tempe, Arizona, where we help build businesses and connect you with the right people. I love it when we have a full house, Daryl. It's always so fun. And today is a very exciting connection with our LinkedIn friend, Dr. Subei, who is a neuro-ophthalmologist and owner of the Brain and Eye Institute. Welcome.
Thank you.
I can't remember how we initially got connected. Maybe Daryl did that for us, our producer.
I think it was a connection through LinkedIn, and I got invited, and I'm like, yeah, this is really exciting.
I'm so glad. And I'm very much looking forward to hearing about your expertise, your experience. And you were kind enough to ask, and she was kind enough to accept, Carly Norton, who is a patient of yours. Welcome to the studio, Carly.
Thank you.
Happy to have you here. How far did you have to travel? You live here in the Valley?
I live in North Phoenix, but it was about 25 minutes.
Not bad. Well, thanks for making time. And where's your office? Or do you have multiple offices?
Currently, I have one in downtown, so around 7th Street and Indian School.
Okay, so not too far, maybe a little farther for you. Thanks for making that. I'm glad we made it midday. And also with us is Dr. Danielle Remington, who is an optometrist. Welcome.
Thank you.
And tell us about your connection with Dr. Subei.
So Dr. Subei and I have mutual patients that we share, and he's also come to be a lecturer at our state association. So.
And what is the state association for?
The Arizona Optometric Association.
And what is your role? A member or you?
I am president-elect. I'll be president in April.
Very good. Well, welcome.
Thank you.
And where is your practice?
So we have 3 locations in the East Valley. One is in Sun Lakes, Tempe, and Ahwatukee.
Okay, not too far
Not
for
too
you.
far,
Yeah. You win the closest award.
Yeah.
I actually live in Ahwatukee, grew up in Tempe, and just really kind of love staying really local. It's been fun. Although this particular winter has been really cold, the coldest my dad and I decided yesterday since high school, which has been a while, and rainy.
Yeah.
I'm starting to see the wildflowers pop through and the green when I'm hiking. I think we're in for a beautiful spring and quite possibly a very hot summer.
Oh, yeah.
How long have each of you been in Arizona? Have you been here a long time?
I have been here 6.5 years.
Okay. From where?
Ohio.
Okay. So this rainy, cold weather is familiar?
Yeah, I'm not like, it reminds me of Ohio too much.
Right. Carly, how about you?
I'm from Washington State. I've been here since fall of 2021.
Okay.
And I'm used to the rain.
Yes.
So
yes.
not too big of a transition.
No. But you've been here 21, been here long enough to have experienced a milder winter with us.
Yeah.
Yes.
Yep.
Good. How about you? How long have you been here?
I've been here about 6 years.
Okay.
Yeah.
Well, 79 for me. Long
Wow.
time. Well, let's dive into our conversation. I know we've got a lot of ground to cover. Very excited about it. Let's first have both of you describe your businesses, the people that you serve. What is this area of eye care that we all need to know about? Do you mind starting for us?
Yeah, of course. So I am one of the very few neuro-ophthalmologists in the state of Arizona, and currently the only one who's still accepting new patients. Neuro-ophthalmology is a complex field where it's basically the backbone of vision. So the eyes will look, yet it is the brain that sees. So that you can think of the eyes as the very complicated cameras, yet the camera without a hard disk and processor doesn't really do too much. And so that's the brain's job. And so the eyes take the picture in, the light in, the colors and everything, and then sends them through the optic nerve, which goes all the way to the back part of the brain where vision is recreated, processed, and made sense out of, all in real time within split seconds. It's incredible. So majority of vision specialists focus on the camera, but it's only the neuro-ophthalmologist that focuses on the hard disk or the brain part.
Wow. And we only have an hour. And that's just one viewpoint, as well as, the connection between the two of you and, of course, Carly's story. And you're the only one in our state or the greater Phoenix area that is currently accepting new patients. There must be high demand for this type of practice. And
Absolutely. Absolutely. Yes. I mean, there are at least a half a dozen neuro-ophthalmologists, but because of constraints in the medical system, it is not financially feasible or rewarding in many ways to practice neuro-ophthalmology the traditional way.
Yeah.
And so I have tried to adapt and learn from different colleagues in different parts of specialties, especially in ophthalmology and neurology. I do traverse, two different fields. So I have the opportunity of learning from two completely different points of view. And I've managed to kind of, get the positive aspects of both neurology and ophthalmology and cooked up a solution to try to make it more practical.
Incredible.
And so far, it's been working okay.
Can I ask what the inspiration or the motivation was to say, "Oh, this is my lane. I need to spend time here"?
It doesn't just happen. I mean, I've always I've always been interested in vision, and it's the most important sense in the human experience. I mean, people who are deprived of vision are deprived of so much. We rely on it so heavily. I mean, we need it to drive. We need it for entertainment. We need it for work. There's very few things that don't utilize vision one way or another in our day-to-day activities. So I've always been intrigued by vision. But then as I got into medical school and I learned more about things, I realized there's very, very little education in medical school about vision. And so I knew that I had to go further and deeper in to be able to figure out what exactly it is that interests me in vision in terms of how to help people. And so it's sequences of events that made absolutely no logic or sense or planning.
That's an honest answer. I love it. Yeah.
Just end up having me engaged in this fellowship in neuro-ophthalmology at Michigan State University. And you can just kind of to explain things a little bit. You can get into neuro-ophthalmology either from the ophthalmology side or from the neurology side. I went through the neurology side. And so I got, and my mentors and my program director and the chairman at Michigan State were neurologists also. We did have some ophthalmology trained neuro-ophthalmologists, but it was heavily neurology driven. And so I learned from them so much. I'm like, this is great. This is just so impressive. It's, in my opinion, it's one of the most, if not the most cerebral aspect of medicine.
And it sounds like so much more to learn about it and has been underutilized. Is that what I'm hearing you say? That it's just now really people are starting to request you to come speak and talk about how important it is, the connectivity between, I'm really dumbing it down here, but between our eye and our brain, huh?
Well, I mean, it's a matter of demand and supply, obviously, like everything is. And so there've been some the neuro-ophthalmologists that have been serving Arizonians have retired recently, and there've been some changes and with inflation and things like that, and changes in the healthcare system that were pretty sudden. There has been a sudden drop, so that practically I'm the only one.
Yeah. Carly, I'm dying to hear how you two got connected, and if you're willing to tell your story, would love to hear that.
Oh boy, where do I begin?
Yeah, wherever you want to.
It's an interesting story. I was diagnosed with CVST, cerebral venous sinus thrombosis, in January of last year. My first symptoms were very severe headache. After experiencing that for about 24 hours or so, I went to an urgent care clinic and they treated me for pain management and said, if this continues, you need to go to the ER tomorrow. So I did that. It continued. The symptoms didn't subside. And I was effectively turned away at the ER. They said I had a migraine, pretty routine. I was taken behind a curtain, given some pain management, and sent on my way. And the following night, I returned to the ER. I hadn't slept since the onset of my symptoms. I couldn't hold down food. I couldn't hold down fluids. And once again, I was turned away. There was really no testing done on me. It was dismissed as a migraine. And the day after that, I had an episode where I was relatively unresponsive. I couldn't speak, really couldn't acknowledge my family members. And so they called 911, and the paramedics came and said it was because I had taken melatonin. And so they said, really nothing we can do for you. This is pretty routine stuff. And for me, it wasn't routine. No, it really wasn't. And so my dad said, you need to get into your primary care because she knows you. So I went in to see her the following morning, and she said, there's something very seriously wrong with you. I had to sign a waiver that, this was potentially life-threatening. And she said, you need to go to the ER right now, and I'm going to call them and tell them that you're on your way. She thought I had bacterial meningitis at that point. And en route to the ER, I had stroke-like symptoms. Wow. So I lost feeling in half my body. I couldn't speak. My dad was racing me to the ER because we were really scared. And I was 19 at this point. So these were not normal 19-year-old symptoms. A stroke is not something that a 19-year-old generally experiences. And so at that point, they finally admitted me into the hospital, and I was there for 2 weeks being treated. But ultimately, after my discharge, my symptoms did not subside at all. They were pretty extreme. I was continuously vomiting. I had extreme pain in my head, couldn't function, couldn't do anything. I was a law student at this point. I had just completed my first semester, and I had to drop out of law school. And I called my primary care, and she said, go to a different hospital and see what they say. And there in the ER was the first time that my vision was examined. And I had been experiencing double vision in the first hospital.
And had been telling that as part of here are my symptoms.
Oh, yeah. I had been telling that, and my vision was never examined. It was finally examined at the second ER. And that's where they kind of briefly mentioned a neuro-ophthalmologist. And an ER nurse said, I actually know of one that's taking patients. And she referred me, or my mom. I was not functional at this point. I couldn't do anything for myself. And so my mom was really in charge of my care. She called Dr. Subei's office, and he was pretty much the first person to take me seriously. And by that point, I was rapidly losing my vision. So ever since I've been in his care, he helped me get an emergency shunt placement, because by the time I was in his care, my vision had deteriorated significantly, and I needed the shunt placement to save the remainder of my vision. But he's really advocated for me like nobody else has. He saved my vision, truly. I credit him immensely. And yeah, even with all my other symptoms, he's been helpful. So that's how we got acquainted. And that's kind of the relationship we have. I still see him. I was seeing him for a while, twice weekly. So we got relatively close. But yeah, that's really the story.
I'm so appreciative, and I'm sure our listeners are too, to you being so vulnerable and sharing your story. It isn't easy to hear that you've been through such a traumatic experience. And my daughter has a chronic illness that started, I think, probably 6 years ago. And all those no's or we don't know, my goodness, it gets to be really hard, especially, I didn't hear that from you, but in my daughter's case, it was almost sometimes people are saying to her, it's just all in your head, which literally in this case, it is in your head, but it wasn't meant that way, right? It was meant like you're making this up and whatever that is. So thank you for sharing. I want to pipe in and jump in anytime as you have other thoughts to share. Okay. I noticed you were taking notes. What of what Carly has shared would you like to add on to that? Because I'm very curious as you hear it from your patient's perspective. What shows up for you when she shares that story? And is that normally how people end up with you? It has to be something tragic before they land in your office.
Yes, unfortunately. And that's the main issue is the medical community's understanding of what neuro-ophthalmology is, its needs, and really lack of understanding of vision in general and visual needs. So first thing is, Carly should have been sent to a vision specialist right away. If her vision is not going to, if anybody's vision is not going to be evaluated while they have visual symptoms, that's a red flag.
And you would say the same thing.
Absolutely. Yes.
Yeah, I mean, absolutely. So
Kind of a no-brainer, at least it seems.
Right.
yes, unfortunately, no brainer is very important.
I'm listening to myself say a few of these. I'm like, wow, these are lots of little silly things that I'm saying, but they're very perspective.
But the fact of the matter is, medicine currently is being practiced in a no-brainer fashion.
Right.
It's automated. So, and this is I think the core of the issue of medical practice today in general. Is it's not taken seriously the way that it should be. It's medicine is being automated in a mindless, automated conveyor belt like fashion, where I can't really call it healthcare. I would call it corporate enterprise that has something to do with your health, one way or another. Usually, not too good of an outcome, at least from my experience. So, a case like this, or Carly's, should never have ended up the way it has. I mean, it's like you said, it's a no-brainer. Somebody comes in, I've got vision symptoms. Somebody examine my vision. Would somebody please? After 1, 2, 3, 4, 5, 6
Encounters.
And we're not talking about, some middle of nowhere. We're talking about the fastest growing city in the country. And we're talking about the biggest medical systems. The issue is the way corporations run the medical system ends up in this automated fashion where reimbursement from Medicare set by the government is designed in such a way to reward quantity and disincentivize quality. So, for example, if any specialist sees any particular patient and they spend 30 minutes or 30 seconds, pay is not very different. So
get them in, push them through.
Exactly. So it's really sad, but you end up with tragic situations.
Yeah.
And it really, Carly's case, and I see similar cases, not necessarily exactly the same, but I see it on a regular basis. And it's really, I have this, when I see situations like this, it makes me really want to change things. And it's really my drive to be practicing neuro-ophthalmology against all the odds. Because, there's a half a dozen, at least the ones I know, other neuro-ophthalmologists, and they were not able to. That's not because I'm brilliant and they're not, or something of that nature. It's because of the basically corporate greed,
the constraints,
driving the medical system into this situation. And so, somebody should have examined her vision and not just considered it as a automated this plus this, A plus B must equal C or D.
If I could just jump in,
Please.
The extent of my vision care during my first hospitalization was, basic, can you see my fingers? And then when I was complaining over and over of double vision, they said, we don't have any eye patches for you here in the hospital. And so ask your parents to go to a local drugstore, purchase one, and bring it back for you. And so I wore an eye patch to resolve my double vision for weeks. And that was it. I mean, I wasn't even provided an eye patch, which, I mean, isn't even...
It's not fixing
fixing
anyway,
anything.
but at least it was something.
It was
the placebo.
It was, yeah.
Wow. Danielle, tell us about your practice, and again, where does it intersect?
Sure.
And then really anything that Carly mentioned, I'd be curious as to what you're sensing as well.
Well, this is the first time I've heard Carly's story,
Oh,
so
okay.
it's. I just applaud you for advocating for yourself and reaching out to Dr. Subei and
Thank you.
Getting your care taken care of. I work at ophthalmic surgeons and physicians. So we are in the East Valley, the 3 locations I mentioned earlier. And we have 4 ophthalmologists and 2 optometrists. And we treat mainly anterior segment disease, which is what I mean by that is a front half of the eye disease. So all disease management, cataract surgeries, glaucoma, corneal specialties. So Dr. Subei and I share patients. Think of us as equivalent to a primary care physician. People come in with complaints. We have to navigate from there. What is the issue at hand? A lot of people, and I don't know, I don't want to speak for you, but maybe had some early symptoms of things going on that they couldn't necessarily describe or understand what was happening, and they'll come in with us. I will do an ocular examination, see if the eye is the issue, right? But we're talking about 2 of the most complex systems in the body. We're dealing with the eye connecting back to the brain. So we'll manage eye conditions. And if nothing is really making sense to us and we can see that there's a brain connection or something kind of unusual, bring in Dr. Subei for evaluation.
How often does that happen? Just, I mean, is it common? Is it typically something? I just don't know anything about eye care at all, other than I wear glasses and contacts. But do you find that there's a frequent opportunity to bring him in?
Absolutely.
Really? And
Absolutely.
I would
All the
imagine,
time.
right?
So if you don't mind, I'll chime in here a little bit. So just to kind of give you perspective. So the brain is the human brain is the most complex entity that we're aware of in the universe. And about half of the cranial nerves, so the brain has nerves that shoot straight out from it. There's 12 of them. About half of them are dedicated to vision.
Wow.
Either vision and balance, which are kind of interconnected.
Sure.
So eye movements, balance, keeping eyes coordinated, working together, receiving the signal through the optic nerve, which really is a misnomer. It's not a nerve. It's actually cylinders shooting from the brain into the back of the eye. So when we examine the eye, we are literally looking at your brain. And about 50% plus of the brain is integrated in processing vision. So, you see something, and then it goes through the eye, like I said, through the optic nerve to the back of the brain where it's recreated, and then it makes sense out of it. Those 3 words are so complex. So, for example, you're looking at in the studio here. You're looking at, you can see a camera, you can see a table, you can see the on-air light, and therefore you have to, these visual inputs collectively come together. They're connected to memory, they're connected to understanding your 3D dimensional, 3D spatial recognition of where things are situated. They're not on top of each other, they're not behind each other, they're situated in such a way that makes you understand that, okay, we're in a studio here. So that visual input, it's not just lights, colors. It's so much more complex than that. There's this 3-dimensional rendering of it. There's making sense of what these things mean. There's facial recognition, for example. There's people who have a disease in a certain part of the brain where they can see and even describe, and some even can draw the faces of their family members and loved ones. But yet when they look at them, they can't recognize them. And so they can see it perfectly fine. There's no problem with the receiving the detailed vision. It's making sense out of it. That's problematic. Some people have problems where they see everything as if it's a 2-dimensional cartoon. Imagine living your life like you're in the cartoons in the 80s or something.
Mm-hmm.
No,
thank you.
So these kind of things, the brain processes and is a lot more complex. And then that's the sensory part. The motor part is moving the eyes, keeping them in position when your head is moving in 3-dimensional space, giving you understanding that your head is moving in this direction, and therefore your eyes are also moving. And when you want your eyes to move in the opposite direction, for example, up, down, all that. There's a lot of input coming back and forth, explaining to you, for example, if you're slipping, how do you prevent yourself from falling? That is enormous amount of information. Your eyes are looking at the rail next to you, and your brain is getting a signal about your feet no longer touching the ground, and you're seeing your feet in the air, and within a split second, you make the determination of understanding what's going on and the determination of what the best solution is, and then you send the signal to your arm to grab onto the rail. So all that is happening in real time, splits of seconds. And so we get a lot of patients with things like double vision, where there's some misalignment in their eyes. And so one eye is pointing in a direction that's higher than the other, for example, for some reason. And there's so many reasons that could happen. The beauty about, and what I like the most about neuro-ophthalmology, is it's really, you deal with systemic neurologic disease that affects vision one way or another. And because, like I said, about half of your brain is integrated into vision, so many things. There isn't a neurologic problem that can't affect your vision. We're talking about stroke, migraines, seizures, autoimmune disease, like your infection-fighting cells attack your brain or nerves, or the junction between where the nerves and the muscles meet. And for example, multiple sclerosis, neuromyelitis optica, myasthenia gravis. These are all systemic diseases that can affect vision, and do affect vision very commonly. And so somebody whose training is in the eye can recognize that, okay, you might have something like this, but it's absolutely not equipped or trained to take care of this systemic neurologic problem. And that's where I come in to help them out. And so there's so much of these issues that vision specialists have a really hard time figuring out how to help these people, because if they send them to a general neurologist, they're not trained in understanding vision. They're not trained in examining the eyes the way neuro-ophthalmologist is. And so there's this huge disconnect where, okay, if they're already diagnosed with something, or they have a very obvious case of a neurologic disease, then okay, yeah, they could definitely help. But more often than not, it's not clear. And medicine, and this goes kind of into what I was saying earlier on, you can't automate medicine. And the reason being is it's not just a science. It's an art of understanding and healing the human body. And the brain being so complex, there's no such thing as inside the box. So in order to practice medicine properly, and especially neurology, neuro-ophthalmology, you have to have creativity. You have to have understanding of awareness of your patient's psychology, their mindset. As neurologists, we know and we're trained to understand that every patient, which could be anybody and will be everybody, as we've seen, anybody, nobody's immune to being sick. Every patient has some amount of psychological component to their disease.
Absolutely.
So, it's usually not 0 or 100. It's usually somewhere in between, and it's variable. And being able to see somebody for the first time in your life and figure that out in a few minutes is an art. So being scanned by a scanner or triaged by some artificial intelligence is not going to tell you
Only
that.
tells one tiny part of the story, doesn't it?
What?
A scan would only say
yeah.
this much about somebody's.
Actually, oftentimes it's very misleading. So, a scan might show something that's just random. Nobody's, human beings are not machines. They're not. There's no such thing as one size fits all. It's a million shades of gray. Even for common diseases, let's just take diabetes, for example. Right. Some people get retinal diabetic retinopathy. They have a problem with the retina part of the eye. Some people get optic neuropathies, like a stroke to their optic nerve. Some people get a peripheral nerve neuropathy, where they get tingling and prickling sensations. Some people get a peripheral motor neuropathy where they can't move their hand or their foot properly. Some people get ulcers. Some people get gangrene. Some people get infection to the bone and they need an amputation. All these people have the same disease. And there is no number or predictor or any test that will tell you that, okay, because you got this test positive, you're going to have gangrene. Because you have this test positive, you're going to have a retinal problem. No,
Yeah, you can't.
That doesn't exist. And so why do we try to tackle medicine as if it is a one-size-fits-all automated, mindless conveyor belt?
Yeah. I don't know the answer to that question.
Well, I do.
I know you do. Yeah. Dr. Remington, I'm curious as an optometrist, when folks come and see you guys in your practice at these 3 locations, I'm assuming then you're looking at the individual holistically as well too. And I'm probably overusing that term, but based on what he's sharing, there's so many different factors.
Absolutely.
And when should somebody come and see you guys?
Every year,
Every
every single year.
Yeah.
Often, I mean, systemic conditions affect the eye more commonly than not.
And we're not clearly paying attention to that, are we?
A lot of people kind of disregard it. They think diabetes, I have diabetes. That's my blood sugar. Nothing else is going to happen to me. Well, like Dr. Subei was saying, diabetic retinopathy is common. You can lose vision from it. So, and that's just one of the many conditions that can affect the eye. So I can't count on one hand the number of times, just in this year, 2023, that people have come in for just, check their eyes for the first time in 10 years and something more serious is happening already because they haven't had an eye exam in 10, 15 years.
Why are we putting it off? Do you know?
That's a good question.
Yeah.
Everyone's answer is different.
Yeah, I would have bet. And for me, although I don't think I've ever put off eye care necessarily, but I have put off my mammogram and my colonoscopy and some of the other things. For me, it was as a mom taking care of my kids and their needs. When my daughter was ill, my husband at the time was very sick. So it was like, well, I'm feeling pretty good.
Right.
I'll just put all my emphasis and time and finances to helping support them because they're worse off than me, which really doesn't help us.
And a
right?
lot of people simplify it. They say, I have 20/20 vision. My eyes are perfect.
Yeah.
Well, not everything affects your eyes right away.
And
by the time it does, it may be too late.
Yes, and which is why it's important to come see you every year, because you're able to tell us a little bit about what it's like to come for an annual.
Just the process that patients will go through?
Yeah.
So we check your vision, make sure, first off, where are you? Are you okay to be driving? Are you legal to be driving? Do you have 20/20 vision without glasses, with glasses? We do the standard contact lens glasses. But then, more importantly, we'll dilate your eyes and see what is happening in the retina. Is the optic nerve healthy? Do you have cataracts? Is there bleeding in the back of your eye? Why is there bleeding in the back of your eye? Is it something that maybe you do have undiagnosed diabetes or hypertensive issues, bleeding disorders? So full eye exam, it's going to cost you about an hour of your day once a year, just to make sure you're staying on top of your health.
And it can tell a story about so much more.
Absolutely.
If you are seeing something.
Absolutely.
And I'm curious, when you're speaking about these topics, who are you speaking to? General public, other doctors? Who needs to hear this? I mean, clearly we all need to hear it, but since we're on Business Radio X, who else do we need to get you in front of so that I'm thinking, so that more people know how important this is and don't have to experience what Carly experienced, or they know who to get to. And I'm also thinking from the lens, there's another reference, not on purpose, but there you go, of future doctors coming through and interest in this area. It seems like certainly we need more than just one of you.
Absolutely. I mean, my goal is, and I started the Brain and Eye Institute, and the goal I have set for this is to be able to take care of the entire state of Arizona's needs for neuro-ophthalmology and everything that comes with that. So like I said, these patients are very complex. It's not like here you take this one treatment and you're fine. Oftentimes they need rehab. They need spectacles of different sorts, maybe prisms, maybe they need infusions because of shunt, surgical procedures. There's so much that they need. Electrolyte changes, weight loss programs. A lot of times, more commonly, we see patients with obesity come with increased pressure in the brain, similar to what happened with Carly, but not because of a blood clot, because of obesity. That's actually a very common thing that I see. It's one of the most common issues that I do see. And the pressure goes so high in the brain, it pressurizes the optic nerves, and it literally kills those nerve cells, and people lose vision permanently. So there's a whole different panel of things that need to be done. And of course, they're highly customizable depending on the patient's situation. And so my plan is to provide all these different services from all these different specialists and all these different services for the entire state of Arizona. However, there are a lot of challenges. And so it's very important for everybody, every medical institution, every practice to know, first off, what neuro-ophthalmology is, and to be able to, like what happened in Carly's case. I mean, that nurse who was at that emergency room was the one that sent her to us. And had that not been the case, I am confident Carly would have lost more vision permanently.
Yeah.
Until she got to see somebody who was able to help her. So yeah, it's very important for people in the emergency room, most commonly, because the emergency rooms are not utilized the way they should be. They have this triage system, and because of the corporate way of practicing or forcing physicians to practice medicine, is this automated way. So maybe 100, let's not even 100, thousands of patients will come in with a headache, but not all headache is the same. You know, Carly's headache was clearly not just a teenager's migraine. And it requires a physician who sits down, talks to the patient, examines them to know that. It can't just be click on the screen, click your symptoms, and therefore we will come up. And this is what happens in the emergency room, by the way. So,
Yeah.
you click on the symptoms you have. Okay, headache, abdominal pain, numbness. Okay, so therefore we'll do a CT scan of the abdomen. We'll do some blood work. And if they're young and healthy, we won't have to do a CT scan of the head. That's fine, unless they meet these particular criteria. So it's like, human beings are not they're not machines. You can't expect that. Maybe it'll work for the majority of cases, but a lot of times you're missing it.
And I think that goes back to Carly's point, and I would love for both of you, all three of you, to chime in. How can we advocate? Why is it important? And how can we advocate for ourselves? It's something that, as I have 28 and 26-year-old, even my 15-year-old, I've been teaching them, you've got to be the one in charge of whether it's your education or your relationships or your job, and certainly your health. You've got to go in and you've got to give them as much information as you have, even if you feel like you're talking too much, and ask a set of questions, because they might not be providing the answers that you're looking for. What would you say that as you become an advocate, and of course you had your parents, thankfully, advocating with you, what's the biggest takeaway that you would share with listeners around their health? And
so, like I said, I was pretty out of it during a lot of my treatment, but I was able to see my mom, and Dr. Subei also advocated on my behalf. And then as I've been able to regain consciousness, almost, I've kind of developed a sense of, you need to take me seriously. This is not something, I'm a woman, I'm a young woman, and I think in the medical field, young women are dismissed all the time. And I think it's just really being assertive. And I think that is a problem among young women, is we have trouble being assertive. We're not taught to be assertive. And so really learning to do that and advocating. I was just talking to 2 other survivors of the same CVST this morning who had almost the exact same experience in the ER, being dismissed. And one was not able to get help like that Dr. Subei provided. One was, but this is something that I've seen over and over again in support groups, that people are not, they're intimidated. And so I think overcoming that intimidation is really important for people like me and people with medical issues, with chronic illness. It's something that's learned, but there's a barrier there that really shouldn't be there. Yeah, it's just really putting yourself out there more than you might have otherwise been taught.
And I'm begging to ask the question, are you back in law school?
I am.
I'm so glad because
Aw.
clearly, as you articulate, right, I can see this passion. Like you need to have a platform and a voice.
Right.
What area of law are you studying?
So, criminal law is my undergrad. And that's really why I came to law school. This summer, I'll be at the Arizona Supreme Court with Justice Timmer in her office. And we'll just go from there. I'm in my first year still, and we'll see how it goes.
It's
But
exciting.
this fall, I'll be working on prisoners' appeals, wrongfully convicted appeals. So it should be interesting to see where that takes me and how that experience kind of shapes what I'm going to do.
No doubt, are your parents super proud of you?
Thank you.
Yeah,
Thank you.
incredible. All right, what else do we need to encourage our listeners to do in order to advocate for themselves?
Just to go off what Carly said, clear communication. And that's on the providers too, asking the right questions, make sure you're listening. But one of the things I always ask my patients, is this normal for you?
Mm.
Are these symptoms new? What's going on that's different and got you worried? Just trying to figure out, why did they come in? Listening to your patient is huge. A lot of people, because we're so rushed with time and, we got to move on to the next person, they don't have time to sit down and listen to the patient in front of them. So just making sure you're communicating. And again, that's on the providers too, making sure you're listening to your patients.
Mm-hmm. Tell me your greatest joy in being in the practice that you're in and the work that you do.
Oh gosh, my greatest joy. I don't know. I mean, it's like Dr. Subei said earlier, everyone comes in saying, I need to make sure my eyes are healthy. I can't work without my eyes, or, my eyes are critical to my job. Well, that's everybody. The eyes, everyone needs their eyes. So just to make sure that I'm there to protect people's health in their eyes and they'll stay seeing for the rest of their life. And if not, figure out what we can do to kind of halt the progression of any disease going on.
Mm-hmm. Thank you. How about you?
Every time I hear Carly's story and I think of the many, many patients that I've helped with similar stories, it's very invigorating, and it gives me the energy to wake up every day and fight the corporations, because like she said, it's intimidating, and it's not just intimidating to young females, it's intimidating to physicians. It's very intimidating to
Absolutely.
physicians.
I don't think I've ever heard anybody say that before.
Well, it's the
Very
reality.
honest and candid.
It's the reality. I mean, if you look at the U.S. health industry overall, just big picture, kind of roughly, about 30% is owned by a few insurance companies.
Mhm.
United, Cigna, Blue Cross Blue Shield, and those are the big ones, and they dictate how medicine is practiced. And so and they have these very strange regulations that you would not think would exist in the free market of the United States of America. We're talking about you can only enroll 1 month out of the year, for example. Imagine that. Imagine if you wanted to buy a car, you can only buy it in November.
Right.
If it's December 1st, sorry,
Yeah.
too late, can't buy a car.
Cars
My
off the
car
lot.
broke down.
What's that?
Cars are off the lot.
Right.
That's it. Imagine what that does in terms of the business perspective and competition. That eliminates competition. I mean, how is that different than price fixing? It's not very.
Mm-mm.
So, okay, you're stuck only once a year, and you're stuck with very high premiums. And this is what frustrates and makes it very difficult for everybody involved. Is, as physicians, we have dedicated decades of our life not to make money. And this is a big, big misconception.
Mhm.
They did this study about the average physician that spend the average amount of time in training and the average specialty and the average income and the average hours they do. And it turns out per hour spent over their entire career, they make the same as a teacher.
Yes, I believe that.
We just work hell of a lot more than the average person does. So it's not about, and with, of course, with the debt, I forgot to mention that the debt for
Yes.
medical school is insane. So, and the interest that compounds with all that. So if you put that all together, we're just like anybody else. We're just working a lot harder than most people. But people think of, oh, these physicians, they're just in it for the money and they don't care. Well, it's actually not the physicians. Physicians from this whole, all the physicians and all the medical providers from the entire medical industry, they make 9 to 10%. 30% insurance companies, 30% hospitals, 30% pharmaceuticals, medical devices, medical supplies, all that. And so if you look at all these industries, the one that has the fewest actual companies is insurance companies, then hospitals, then pharma, and medical devices. And so they control everything. And with inflation that just took place in the past couple of years, all of those industries have increased their pricing and increased how much revenue, except for physicians. You know what happened? Medicare cut it down by 2%.
Oh, wow.
And since 2002, Medicare has cut down physician reimbursement by about 25%. So imagine an industry where you lose 25% and then you add about a 20-30% inflation. We're talking about a 55% reduction in profit. Yet somehow people expect the quality to be the same. It makes no sense.
Mm-hmm.
And so I'm saying this so that people understand what's going on. People don't, there's not enough time to sit there and explain this to every single patient.
Right.
I mean, it's just the system makes sure that you don't have enough time.
Mm-hmm.
It's about quantity, turn and burn, like you said. So,
And the parallel to at least the public school system, I find fascinating. I'm a former educator, third grade teacher and assistant principal, and it's butts and seats, just like quantity over quality.
mm-hmm.
And the teacher, much like the physicians, like you guys, we're the ones on the front end,
Exactly.
and have been, most of us have gone into those professions because we care and we want to make a difference. And yet our hands are tied and our backs are up against the wall because of all these other, enterprise players.
Exactly.
Absolutely.
Yeah. I think that the teachers and doctors have very similar roles. It's a different industry,
Mhm.
but it's pretty much, the same role. You're sacrificing yourself for others, very selfless. And it's very disheartening when people speak ill of teachers or physicians. I mean, I'm sure not 100% of teachers or physicians are great, but the majority of them are. I don't know one physician that went into medicine because of money.
Yeah.
And the situation is because of how difficult it's becoming financially to practice medicine independently or in a small practice. Small practice almost doesn't exist
They're
anymore.
going away.
Yeah, especially in ophthalmology and neurology because they require so much expensive equipment. The overhead for starting a clinic is hundreds of thousands of dollars. And that's why, for example, the people I bought my furniture for my clinic from are ophthalmologists who have been practicing successfully for decades, and they're doing great, and they have great reviews, and their patients love them. But they're like, you know what? It's not. I can't do it anymore. I'd love to, but it's too difficult. It's
Hearing the same thing from my teacher friends who are retiring. I'm done. I'm tapping out. It's too difficult.
exactly. So these corporations, they come and gobble them up. And then you have the same kind of automated
Mhm.
medicine that end up in Carly's situation.
Yeah. As we kind of round out our conversation, I would love to have a longer conversation now. However, you all have lives, and I've got a baseball game to get to. I asked Carly and Dr. Remington this question. I want to ask you as well. What can patients do to advocate? Let's take your question a little bit broader than that, to advocate for a stronger and better healthcare system. And then I'd like to have you answer that from the perspective of physicians and providers as well.
So the way I practice is I do get my patients involved, even though they may not always necessarily like it, but they have to be involved. Your insurance company is giving you a hard time, and they're preventing your ability to get the care that you need for whatever, whether it's medication, treatment, diagnostics, etc. You need to be on the phone with them.
Oh, I get it. It's so hard.
It
And yet
is.
we have to.
It is. It's challenging, but if you're not going to do it, you're going to rely on your physician staff to do it, and there's only so much they can do. Especially that you're the customer. So from a business perspective, the insurance companies actually, and practically speaking, they were more responsive to your direct needs because you're paying them the premium,
Mm-hmm.
and therefore you can in November switch to another company. And that's how they regulate that. And so you can switch to another company, therefore they need to listen to you, and they're more likely to, practically speaking. And so I always encourage my patients, I'm like, okay, you need a prior authorization. We'll help you. We're not going to just let you hang dry, but you need to advocate for it. You need to be on the phone. You need to call them. And 90% of the time, it works so much better. It works so much better.
And when you get a no, you have to call again, right?
Yeah.
And continue to, I've been through several appeal processes within my insurance companies on behalf of myself and my kids for different things.
Exactly. Just like what Carly did, and her family did. They advocated for her. They didn't just take a no for an answer, because that's what the corporations do. They stiff arm you until you give up.
Mm-hmm.
And so you got to keep fighting until you get what you need.
Mm-hmm.
And it's always a fight. So, average physician will see like 25, 30 patients a day, 5 days a week. Let's just say they don't do weekends. That's about 150 a week. That's 600 a month. And that, let's say they did 10 months, 12 months, that's about 7,000 fights a year.
Mm-hmm.
So you got to help them if you want to help yourself. So that's what I would say. The first thing is get involved with your payers' issues to help resolve them. And then what I would also say is, as a broader issue, I think, especially in terms of small medical practices and the specialty of vision and neurology, neuro-ophthalmology, ophthalmology, optometry, I have been trying to get a hold of the governor, Katie Hobbs, both our senators, to fix this problem and provide adequate compensation for small medical practices, because like we talked about at length, it's the small medical practices that give you the time that patients need so that they don't end up in a situation like Carly's. And so they need funding. It's not going to happen with all the cuts that keep happening. At least compensate for the inflation, which the rest of the industry has. So it's got to be fair. If you want a good service, you have to allow the good service to be viable. And that's where I think contacting the governor, the senators will be helpful. And so these are some of the things that patients can do. For physicians, I think physicians need to unionize. If you don't like that word or that particular setting, some arrangement for collaborative negotiation. Hey, we need to be able to provide our care for patients the way that they need it, not the way that makes more money and at the expense of people's health.
Mm-hmm.
And so, physicians tend to have this nature of being separated, and I think it has to do with the way they train us. Is like, oh, that's cardiology, they have their own thing and they're weird, or whatever. I'm not picking on them, but
As an example.
that's just as an example. And so, neurologists, though, they're definitely like different, which they are. But there's this kind of division.
You're saying it would be beneficial to have a collective voice.
Absolutely.
Yes.
Yeah. I think that's a good place to start.
Mm-hmm.
And I am seeing that there are some organizations out there that are trying to do that. And There has been, I think, what Proposition 209, for example, came up against predatory actions of hospitals and medical corporations to stop predatory financial abuse of patients with interest rates of above 10% that are compounded, which basically scares the hell out of everybody, and that's why they go running to buy expensive premium health insurance, and then the health insurance company tell them, we're not going to do this, we're not going to do that, we're not going to pay for you. So going to the physician's staff and yelling at them is not going to fix the problem. That only makes it worse, because then the staff will leave, and then
All right, now we're really in trouble.
Yes.
Wow. So many great stories that you've all shared. In addition to kind of directives, it's definitely something that that needs to change. I'm
Absolutely.
appreciative that you're willing to say, here's how I'm showing up in this space, and this is how I would like to see all of us kind of collectively come together. How can people get in touch with you, not only as patients, of course, but maybe physicians or a practice that's listening, or somebody who's going through school? You're on LinkedIn. We know that because that's where we found you.
Yes.
But what is the best way to get in touch if there is a professional and a provider, a physician out there that says, gosh, I want to run alongside you with this?
I would say the best way to contact us will be by email. Dr. Dr. Subei @brainandi.org.
Okay, and Subei is S-U-B as in boy, E-I.
Correct.
Okay, very
Yes.
good. Thank you so much for accepting our invitation to come and share your story. And I'm greatly appreciative that you brought these two incredible human beings here with you as well. Carly, good luck to you in law school.
Thank you.
So this is year 2 for you then? This is
my first year still. I'll
you
be
have to
done
take
with
a break.
Yep, I had to take a break, but I'll be finished with my first year in May. So
Fantastic. And 4 years at ASU?
I for law school or for undergrad?
Well, undergrad.
So I went to the University of Washington for
Okay.
undergrad.
Yeah. And so this is how many years at ASU then until you have your law degree?
3 total.
Okay.
So about 2 more years to go.
You can do it.
Thanks.
Super impressed with the way you've shared your story today, and again being vulnerable and kind enough to do that to help accentuate the points that both these doctors have had for us today. So thank you for spending time with us.
Absolutely.
Dr. Remington, how can people get in touch with you, and what is the best place for people to start and join your practice?
So I am on LinkedIn, Danielle Remington, but other than that, calling the office, ophthalmic surgeons and physicians, 480-839-0206.
Awatuki, Tempe, and
Sun Lakes.
as
Yes.
well. Yeah, very. And is it open to patients of all ages? What's the youngest patient that you would see?
So late teenage years and up, typically.
Good. So good. Thank
Yes,
you all for
thank
being here.
you.
Really
Thank you
deeply
very much.
appreciative of the conversation. And I'm hoping we can have an off-air conversation about how we might be able to help you make some of these differences on behalf of legislature, and making sure that Arizona is, a force to be reckoned with, and making some really solid decisions around how to protect our patients and be advocates for our providers. So
Absolutely.
looking forward to it. You've been listening to Phoenix Business Radio, broadcasting live from Mac 6 Entrepreneur Center right here in Tempe, Arizona. Some media let me try that again. I do it every day that I'm here. Some media leans left, some lean right, and we lean eye care. How about that? No, we lean business. Thanks for listening. Karen Nowicki. We'll see you next time.